Welcome back to the Stigma podcast. I'm your host, Stephen Hayes, and today's guest is Alyson Watson. Alyson is the CEO and co-founder of mental health unicorn Modern Health. The company has raised over $170 million from some of the best investors in the world, like Founders Fund, Kleiner Perkins, and many others in just a few years since inception. Modern Health is a global mental health benefits solution for employers that covers the full spectrum of mental well-being needs, from tech-enabled solutions to professional support solutions, all at the same time in one place on one platform, accessible to an entire company's workforce. Whether an employee wants to actively manage their stress or treat depression, Modern Health can guide those people to the right level of care and help companies save money in engagement and healthcare costs. I'm really excited to have Alyson here today and to get to talk to someone who is truly a pioneer in the mental health startup world. So without any further ado, let's get into it. Alyson, thank you so much for being here today.
Thanks so much for having me. Super excited to be here.
So I wanted to start by having you sort of tell your story. Give us a little bio background on you and how you kind of found your way into the mental health startup world.
Yeah, it's a good question. So mental health has been close to home to me for a number of reasons. So, even growing up, I'm someone who has struggled with anxiety ever since I was a little kid. And my first time actually seeing a therapist was in high school. And during that time, I think every family goes through challenges. My family did as well. And my dad also struggled with cancer. And during that time, seeing a therapist played such a big role in my life. It actually had such a positive impact. And I couldn't believe that this thing that was having such a positive impact in my life was so taboo. So had such a stigma, right? I would sneak out of high school to go see a therapist and not tell anyone about it. And fast forward to my time at Johns Hopkins. So I went to Johns Hopkins, where I was also on a scholarship for lacrosse, and, was motivated to go there because I thought maybe I wanted to be a doctor and was really passionate about the healthcare space overall. And I struggled again with anxiety. And I noticed that a lot of girls on my lacrosse team also struggled, whether it was anxiety and everything from just how you show up and are playing and ability to walk out on the field and just feel comfortable. And I think that, and we had coaches for everything you can imagine related to our physical health, nutrition, weight training, running, endurance, but nothing for our mental health. And I couldn't believe that, wow, arguably one of the top medical environments in the world, and there's no focus on our mental health. And so I just became fascinated by the mental health space. I got super into mindfulness, meditation. Actually, mindfulness played a huge role in my dad's recovery, and I ended up becoming a yoga instructor and just kind of going down this path of becoming really fascinated by the mental health space and realizing, wow, our minds play such a big role in how we perform as athletes, let alone students, let alone professionals. And that's really when the antenna went up for me. And I started to realize, why don't we focus on our mental health, the same way we know it's important to take care of our own physical health. And so I ended up working in healthcare consulting and then worked at a few different digital health companies before starting Modern Health, and definitely had some ups and downs along the way. But ultimately took the plunge and started Modern Health about 3.5 years ago, and have grown quite a bit over those last few years. We're now 250 employees. We support over 250 customers around the world. And what we do at Modern Health is we work with companies, we work with employers to make it easy for their employees to get access to mental health resources. We believe every single person on the planet should have access to mental health support. And so we work with employers to give their employees everything from therapy to coaching to digital content and tools like meditation, and all of this in an evidence-based way that's super engaging and ultimately drives really meaningful outcomes for the employee and the employer.
So can you tell me a little bit about what was really going on in your life leading up to those moments when you thought that you should create Modern Health, that you should build a solution to help people that had struggled with finding mental health care?
Yeah, for sure. And I think even worth calling out, taking a step back, I moved out to the West Coast with this dream of starting a company, and it was a complete disaster when I got here. I booked a one-way ticket, and within 3 weeks of moving out to San Francisco, I lost my job. My boyfriend at the time broke up with me, and then my apartment flooded. And I ended up, the moral of the story I always say is to get renter's insurance if you don't have it, because it paid for me to live in a Holiday Inn in San Francisco for quite a while I got my feet under me. But I laugh about it now, but I honestly was really depressed. I thought, why the heck did I just move across the country and leave my family and friends and just uproot my entire life and feel like I just hit rock bottom? And it was in that moment where I decided to see a therapist again. And I'm like, I'm going to go find a therapist. And I went through the experience that, many of us have gone through, many of us have heard about, which is just a terrible experience of trying to find not only a therapist, but one that you can even afford, someone who would agree to a sliding scale rate. And I ended up, after going through that experience, getting connected to this therapist that I still see 7+ years later, who's had a huge, huge impact on my life. I can safely say, wouldn't be here today if it wasn't for all of his support. And it was in that moment where I realized this is an area I'm going to make a dent in. Like, this is so important to me that people don't go through this and that people can get access before they feel like they're in crisis mode, before they feel like they've hit rock bottom. And so I ended up working in the digital health company, a number of different digital health companies before starting Modern Health. And I think that really helped me build a foundation for understanding just even how startups work and getting exposed to whether it's product or engineering or operations or sales. But that definitely helped me build a foundation so that when I was ready to start Modern Health, I had, that launching pad of what I had learned from those different companies. And so I ended up quitting my job and applying to Y Combinator and thought there was no way that we'd get in. But one thing that we did that I think really helped us was we talked to a number of founders that had gone through IC, and got their support. You can actually refer other founders and it helps increase your chances of getting an interview. And two, really got their help from our application to the prep process to the interview prep. And so we ended up getting an interview. And if I recall, the interview is about 10 minutes, goes by, it feels like it's 30 seconds. And then they let you know that night. And you find out, you get a phone call, which means you got in. And if you get an email, it means you didn't get in. And so I was like, I can't keep staring at my phone. I need to, go clear my head. So I remember going to a yoga class and just wanting so badly to run out and check my phone, but I didn't. And then after that class, I got the phone call and we got in.
Wow, that's amazing. And what was the state of the product or the state of the idea when you went into YC? It was pretty undeveloped at that time, right?
Pretty much ground zero. Yeah, we pretty much had an idea and, had started working on some mock-ups of an MVP. And my previous roles working in digital health, I had spoken to customers that we worked with at previous companies who were looking for a mental health solution. So I had validation of, okay, if we build this thing, people will want to buy it for their employees. And so we knew that, to some extent that we would have product market fit once we got this product built. And so when we started YC, it was pretty much ground zero. We were just getting the product off the ground. And I think the beauty of YC is when you're starting a company, if you're a first-time founder as I am, you're learning things for the first time. You've never done it before. So everything from even how do you incorporate a company to how do you hire your first few engineers? How do you get a product out the door? How do you close your first customer? Going from zero to even getting your first customer, it's hard for those who are selling products to employers to go convince them to take a chance on you. So YC really helps, one, create a sense of urgency in the early days, and two, just honestly kind of teaching you the lay of the land of how to even start a company, like really just the basics that if you haven't done before, it would arguably just take you so much longer than it takes when you're going through IC. And so I think part of the benefit of YC is really creating this sense of urgency, which is demo day, right? And making sure that when you get up on stage, at demo day, that you've reached certain milestones and you feel confident and you've accomplished something, accomplished aggressive goals that you've set out to accomplish during that time frame, so that when you get up there on stage, you're proud to share those milestones, and ultimately that hopefully results in raising additional capital that can give you a chance on realizing your mission.
And what were some of those aggressive goals that you set for yourself in those early days?
Gosh, there was a lot. I think everything from having certain features and products built. Even just getting an MVP out the door that worked, that could actually connect people to care, was an aggressive goal for us, which we were able to achieve by the end of it. And also signing our first few customers. When you're at zero customers and just getting a product off the ground, how do you get those first few employers to take a chance on you? And I was very lucky to I pretty much cold LinkedIn messaged hundreds of people leaders out there, and most of them ignored my messages, but some of them responded. And they said, we love what you're doing. We love this idea. This is such an important problem to solve. And we have a huge need for this at our company. So once you get your product live, we'd love to try it out. And so those, early companies that took a chance on us really did shape and change the trajectory of Modern Health, because we learned from them. They gave us feedback. We were able to further develop the product. So I think even just getting our first few customers when we were just starting the company in pretty much January of 2018 was an aggressive goal for us. We ended up launching our product to a few customers by the end of YC. Our product was live, and some people, small numbers, were getting access to our product, within 6 months of getting the company off the ground, which was pretty exciting for us.
That's incredible. And so conceptually, selling to an employer, I think most people understand that, a lot of us get our health benefits. We get a lot of benefits outside of health, even from our employers in the United States. But employers haven't really been providing mental health care up until now. Why is that? And why is going after employers probably the really smart way to deliver mental health to a lot of people?
Yeah, it's a great question. I think really what we've seen is a shift in, just honestly, from a cultural perspective and from society and how we perceive and talk about mental health. I think one of the great things that has happened over the past few years is, as mental health becomes more destigmatized, which is amazing, more people feel comfortable speaking out about needing support. Traditionally, when people think, oh, I need help for my mental health, they think, I need to go see a therapist. Okay, how do I do that? I go through my health insurance. Well, we all know, it's pretty difficult to get access to therapy through your health plan, right? Most providers don't accept insurance, and that's because the reimbursement rates are just so abysmally low. Like, why should they? And so if you try to get access to mental health support or a therapist through your health insurance, I often say it's like having Netflix without internet. You're supposed to have access, but you can't. And so employees, if they tried to get access to a therapist maybe even 5 years ago, they probably didn't go to their employer because there was that stigma. But now they do. Now they say, hey, I tried to get access to a therapist. I've called 20 of them. 2 of them responded and said that they have a 6-month waiting list, and I need help. I need support. And so now those employers can no longer just point to their medical plan or even point to just their EAP, because it is a similar experience. And so that has been a forcing function for employers to say, you're right, we need to invest in mental health benefits. And that now has resulted in mental health becoming the 4th pillar of benefits. You've got medical, dental, vision, and now mental health is that 4th pillar. Now it's table stakes. Employers have to offer a mental health benefit, 1, to really be able to support those in need, but 2, everything from attracting and retaining talent to showing their employees that they care about them, and then ultimately to impact their bottom line. I mean, we know now that mental health has a huge impact on productivity and absenteeism in the workforce. And even before this pandemic started, mental health was the number 1 cause of disability worldwide. So the number 1 reason that people took time off from work was related to mental health. And so now all of this is just coming to a head where employers, the silver lining here is employers don't have a choice. And it's not only the right thing to do, but they don't have a choice. So they have to do it, which is the right thing to do, which is to invest in mental health resources, because they believe, like we believe, that every single person out there, just like we believe they should have access to adequate healthcare through their medical benefits, they should have access to mental health support as well.
So there's an obvious connection or correlation to the bottom line of a corporation and providing mental health care, even if it's just simply reducing the downtime or reducing the amount of time people aren't at work because they're struggling with their mental health. Is that the right way to think about it?
Yeah, exactly. I mean, so many people, especially over the last 18 months, there's so many things going on in addition to the pandemic, right? Obviously, ongoing racial injustice, what's happened in the political environment, climate change, people getting displaced from their homes, people, being isolated at home, unable to see loved ones, people suffering from loss of loved ones from the pandemic, all these things that many of which were going on even before this pandemic, but this pandemic has amplified, is coming to a head, and it's causing employees to really impact their ability to be productive and to show up at work and to be able to even focus on what's in front of them, right? It's impossible to tell employees to compartmentalize what's going on in the world and in their personal lives when they show up at work. And the employers who think that that's possible, will have a reality check, and within the next couple of years, when they realize, wow, those employees have left and they've gone and worked at companies that have actually supported them and understood that we need to support them so that they can show up to work and be their best selves. And so I think a huge part of this is honestly just the way that society has changed, because of technology. If you think about us as humans, we pretty much look the same as we did hundreds, let alone thousands of years ago. And if you think about the rate at which technology has advanced relative to how civilization, and how civilization has progressed, it's like we are a V1 operating system in a V1000 world. Like, how can we expect we as humans to keep up with, being tethered to technology, having our phone next to us when we go to bed, when we wake up, getting notifications all day from LinkedIn, Facebook, Twitter, Instagram, you name it, feeling like we are jailed to technology in a way. And I do feel that we're finally at a point where people are realizing, yeah, of course, this is impacting our mental health. We've never lived in this type of environment before. And that coupled with all the other things happening in the world that I just mentioned, it would be impossible for someone to believe that this isn't having an impact on our mental health. And the numbers are proving it, right? Depression rates are skyrocketing. Suicide rates have gone up, especially with adolescents, which is terrifying to think about. And so, we've gotten to a point where if we don't do something about it, the rate at which we are innovating will actually eventually decline, because the next, you can no longer say $1 million idea. I guess the next $1 billion idea is, it's in someone's head. And so taking care of our minds is honestly, it's crucial to us continuing to be successful as a society and continuing to innovate and to have the benefits from technology. We have to take care of our minds first. We have to take care of our mental health, or, it's a pretty scary outlook if we don't.
Yeah, it's almost like we couldn't possibly innovate anymore without taking care of our minds at this point. It's almost like the good ideas might even be imprisoned in our minds with unhealthy mental health. It's something that for our species to survive, we must figure out how to get this right in a way.
Yeah, I mean, and we see it in the numbers, right? Recent research has shown that within the US, 40% of adults say they are struggling with mental health issues or substance abuse. It's almost half of the population of adults. And of course, that's going to impact people at work and their ability to be present and creative and innovative. And so, yeah, we really do have to take care of our own mental health, and we really do have to prioritize it in order to be productive, be present, invest in relationships, connect with others. And that will ultimately pay dividends. For those who feel, mentally well and fit and show up to work, feeling good are going to see the impact in their work, right? They're going to feel more productive. They're going to be able to make a bigger impact. And so employers should be motivated to really help employees take care of themselves.
And you had talked a little bit about stigma and destigmatization. I think that there's this significant untapped source of demand for mental health care that's coming to life because of destigmatization. I think all of the businesses in our space are seeing that right now. Do you run into stigma when you go to a corporation and say, hey, I want you to provide mental health care to your employees and I will provide that for you? I would imagine in the early days, there were a lot of companies that said, yes, we really want to do that. We've already been thinking about it. And then now as you grow, you might start running into companies that are kind of like, why should I do that?
Yeah. I mean, I definitely think there is still stigma. I mean, look, we live, for those of us working in tech, we live in a bubble, and, working with and supporting other companies in tech, even where mental health has become more destigmatized, which is amazing because we'll pave the way for everyone else. There is still a stigma in many other industries. And, I just feel so fortunate that we at Modern Health have gotten to partner with some amazing customers that have really paved the way. We're now working with over 250 companies around the world, including, companies like Okta and Pixar and Carta, Cliff Bar, Zendesk, TripActions. And these leaders are pretty open about their own mental health. They'll share their own struggles. They will really highlight the importance of why they're investing in modern health for their employees. And being vulnerable in front of your workforce as an exec or from a leadership position is so powerful. People don't even realize how powerful it can be just to state, hey, mental health is really important. I see a coach or I see a therapist, or I've struggled at this time in my life when I became a new parent, or I, lost a loved one. And, here's how I coped. Just being able to be vulnerable is really making, I think is what's going to change how we talk about mental health from an employer perspective in the workplace. And honestly, just more generally, as society starts to just be more open about the struggles that they're having. And so I think employers can play such a huge role in this. I do think there is still a stigma there. Many leaders don't talk about it. They're afraid that by, saying that they struggle, and by the way, everyone struggles at some point in their life. And, almost 100% of people feel depressed at some point in their life. And so it would be unrealistic for any leader out there to say that they haven't struggled. So even, at companies where there is still a stigma, it's really on the leadership to start to set an example and open up about these things. And I do think that we're going to see a huge, huge shift over the next 5 years of people just being much more open about it. And I think, look, famous athletes and famous actors, speaking out about these things and sharing their own struggles has played a huge role in shifting that conversation as well, because these are people that seemingly in the eyes of society are very successful. And of course, no one would think they struggle with mental health issues, but they do, just like everyone else. And so that's also played, I think, a huge role in the shift around just the conversation and the stigma.
I agree. And I think, like you said, companies have done a lot here. I think companies that are working with you are pioneering what the future looks like for, the company's involvement and companies' responsibility to help their employees with mental health. What are some other things that companies can be doing to improve the mental health of their employees? I mean, I think working with you guys is sort of like a base step. They should all be doing that. What else can they be doing to sort of increase the conversation around mental health, destigmatize it at work, and get people proactively taking care of themselves in a way they've never done before?
Right. Yeah, no, it's a good question. I'll have to be shameful and put in a plug for Modern Health here, but, I think whether it's Modern Health or another solution, certainly the first step for an employer is to invest in a mental health solution for their employees. Employees need somewhere to turn that is not going to result in 50 phone calls when they're already feeling in crisis mode and hoping that there's some therapist out there that has, room to slot them in through their traditional medical benefits. And so really, I would just encourage every company out there, whether it's Modern Health or another mental health solution, to invest in a mental health solution for their employees. It's just table stakes. And honestly, I almost view it as like each company needs to do their duty to help, make a positive impact in society, and helping their employees' mental health is the first step in doing so. And so beyond that, I think there's a lot of things we can do from a cultural perspective and really setting a culture where people feel comfortable. And that's everything from prioritizing diversity within your culture, letting people show up and be themselves and be authentic, connecting with each other. I think there's a lot of jobs out there where people go through their day-to-day and they go through their to-do list and they don't really connect with others at work. And we spend most of our lives working. And it's crazy to think about a world in which you spend most of your life working and you don't actually connect with others, within your team or within your company. And so I think one thing that we try to do at Modern Health that I certainly, encourage other companies out there to prioritize is creating a culture of connection where people can be authentic in front of each other and they join meetings, and it's not just you jump into your to-do list, but you say hi to someone's kids in the background, or you get to know them for who they are and get to know them personally, and they get to know you, and really check in with each other and really care about each other, and flexing that muscle of empathy as an employer and as a manager and as a teammate and as an individual. We're all human. We all make mistakes, and being there for each other and being open and caring for each other means so much more than any paycheck or any title. And at the end of the day, what drives human happiness is actually authentic human connection. So feeling like you can connect with someone else in a way where you can be yourself, be authentic, be genuine, and be vulnerable. Ultimately, that connection is going to drive much more happiness than any, materialistic thing in your life. And so I think that's one thing that we've really tried to create, from the inside out within Modern Health, is building that type of culture where people have fun. Like if you're not enjoying yourself, and of course work's going to be hard and stressful at times, but if you're not able to be playful and have fun and connect with others, then what's the point? So I think part of it is like not taking ourselves too seriously and really trying to enjoy our lives and enjoy our day to day. And I think employers can play such a bigger role than they realize in that, in creating that type of environment where people don't show up to work and get so drained, and then they go, spend time with their family, but they're so drained from work. It's like, let's add to people's lives. Let's have them show up and be able to leave work with some energy so that they can, show up in their personal lives as well. And I think, employers, I just can't iterate enough how big a role we all can play in making a positive impact in people's lives.
And I think you guys have been a huge part of changing the way employers do that and providing them that opportunity. The growth you've experienced has been incredible. I mean, you mentioned earlier that you had around 250 companies that were your customer. I think I saw somewhere that you were in several dozen countries. You had incredible growth to date. There's no doubt about that. What is the vision? Where do you see Modern Health going? What does this company look like in 5 to 10 years?
Yeah, it's a great question. So our vision is we see a world in which access to incredible mental health care is a right? Everyone should get access to it. It shouldn't just because you work at a certain company, and it shouldn't be based on your socioeconomic status. Just like we believe everyone should have access to great healthcare, we believe everyone should have access to great mental health care. And so our mission in that is to create access to as many people as possible, to bring mental health support and solutions to as many people as possible. And so that's why we've gone through the employer route to date, because we feel like that was the fastest path to getting our solution in as many hands as possible, because once we sign up an employer, right, all of a sudden thousands of employees get access overnight. And so that's, really what we see over the next, and hopefully it doesn't take 5 years, but even over the next 3 years, is a world in which mental health really has solidified itself as that fourth pillar. Every single company out there is going to offer a mental health benefit just the same way that they typically offer medical benefits. It's a right for every single person. And not only getting access, but getting access to really high quality care that actually is engaging and actually drives outcomes and actually helps them, and making mental health a part of our everyday life. Just like we know it's important to try to take care of our physical health, we should be thinking about our mental health, if not the same, if not more than we think about our physical health.
Yeah, absolutely. And I know we're getting close to the end of our time here. And, a lot of our audience are founders that are either building in this space very early stage, or they're aspiring to be founders in this space, or maybe they're building a clinic, or they're building something to help people with their mental health. So I have a couple questions kind of from their perspective. And I wanted to ask you a little bit about based on what you've learned from 2019 till now, what advice would you have for an aspiring founder trying to build a mental health startup? What do you wish you knew 3 or 4 years ago that you now know that was a total mystery to you at the time?
First thing that is coming to mind for me is just take care of yourself. I feel like so much of starting a company, and the irony of me being, in the mental health space, and probably many of the founders listening to this in the same space, is there's no hyper growth startup out there, or even company, that has reached certain levels of success without a lot of hard work. And that typically requires putting in a lot of hours. Like, it's just impossible. If you look at all of the legendary greatest companies out there, there's no way it just goes, oh yeah, and all of a sudden we're here and, we made it and it wasn't so hard. No, there's a lot of hard work. There's a lot of hours. There's super stressful times. It can be there's like super anxiety inducing times when you have to get up in front of investors, or you hear no from 50 investors in a row, and you got to keep going, because if you don't, you got to shut your company down. And maybe you're employing people and they have, their salary, they rely on their salary to support their family. And so there's a lot of stress associated with running a company. And I think it's really important to make sure that you're not doing it at the cost of your own mental health, because ultimately that's going to make a much more positive impact in the long run than being so stressed out and burnt out that your company doesn't make it anyways. And I learned that the hard way. I think I realized, okay, I can go a million miles an hour, and I'm so passionate about what we're doing. I care so much about solving this problem that I've just got infinite energy. But every high that you ever see with any founder out there, where you see in the news that they've raised a round or valuation, and you see a smile, or you see this, or you see that, there's always a low to match it 100% of the time. And so I think it's just being really honest with ourselves, especially as founders, that in order to achieve those highs and certain levels of success, there's going to be lows to match it. And the only way you're going to get through those lows is if you take care of yourself and your own mental health. And so I, pretty quickly learned that I need to invest in seeing my own therapist, which I still see to this day. I'm an executive coach. I have a couples therapist, and I'm very vocal about all these things. I would not be here today if it wasn't for the support from that support system that I feel so, so fortunate to have. My husband, who's there for me, and I just feel so lucky and fortunate that I have been able to learn how important it is to prioritize my mental health, and now have the resources to do that. I understand not everyone does have those resources. So I feel very privileged and grateful that I've got access to those resources. But just even the little things of taking care of yourself, which is eating well, getting sleep, taking time away from being tethered to technology, whether it's meditating even for 2 minutes every morning just to focus on your breath, or getting outside for a quick walk. But taking care of your mental health is going to have a much bigger impact on your company than you may realize, especially in the early days when it can be hard not to want to just go 24/7. And so I think, honestly, it might sound kind of corny, but the biggest advice I'd have for aspiring founders in this space is to take care of your own mental health. And, the easiest analogy that we like to use within Modern Health is, when you're on an airplane, they say you put your own face mask on first before you put it on the person next to you. And that's true for running a company as well.
That's great advice. That's really great advice. And you've been building in this space, and this space has been exploding. Your business has been growing. You've learned a lot, obviously, about the mental health space. Where do you see the white space opportunity? If you could just start today with a blank canvas and create anything in the mental health space based on what you know now, what you've learned, where is that opportunity for entrepreneurs now?
So much opportunity. I think two things jump out for me right now. One is around adolescence. it's really sad to look at the data around suicide rates of kids. It's heartbreaking. And I do think that we're going to look back on social media, like, Instagram for kids as like cigarettes. Like, what? We let them like consume that in an unlimited fashion? Like, what the heck were we thinking? And so I think finding a way to solve for the future generations where we can give kids the tools they need to thrive and be resilient to the impacts of technology, because the future generations are going to live in such a different environment and world than we all were even raised in. I mean, the way that technology has changed so much in our lifetime. I mean, it's kind of crazy to think about that in our lifetime, we didn't have cell phones. Like, it's really interesting to think about, and it's just going to be so different. So I think for adolescents, solving that problem, there's a huge need there. And I think that is an area that I would be super interested in. And then I think another one that's super interesting is tying it back to physical health, right? We know that if someone is struggling with a mental health issue, they're more likely to struggle with a comorbidity, whether that's diabetes, heart disease, chronic pain. And vice versa, right? If they're struggling with a physical health ailment, it impacts their mental health. And I think it's fascinating to start to think about how can, by improving someone's mental health, we show direct correlation to improving their physical health and longevity and help reduce just illness overall. So that gets me really excited as well.
And who would you want to partner with? Are there, for aspiring founders who may look at Modern Health as a partner for them, are there people building things that you'd want to partner with at Modern Health? And if so, how would a founder go about sort of initiating that conversation?
Yeah, I think, there's many different distribution channels, whether you're going direct to consumers or through employers or health plans. I think that's another interesting aspect of just the healthcare industry overall, is the different distribution channels to get your product in the hands of so many lives. And so whether it's partnering with a company like Modern Health to get your solution in the hands of employees, or whether it's working with a huge carrier to get the hands and to the members who have access to their health insurance. I think that's another really interesting point to call out, is there's so much opportunity to get your product in the hands of these different lives through so many different distribution channels.
What's the best way for someone to connect with you? Is it a LinkedIn message, or I know you perfected the LinkedIn cold outbound in your early days. So what's the right way for these founders to connect with you?
Yeah, I think that's a great one. Hit me up on LinkedIn. And my name's Alyson Watson, and I'm the founder and CEO of Modern Health. So if you look for that in LinkedIn and add me, I will make sure to accept and respond back to you.
And I'll link to that in the show notes so people can find it easily. What did I miss? What should I have asked you? I feel like you know so much more about this space than I do. As an incredible builder in this space, there's probably an obvious question that I should have asked. What did I miss?
I think the biggest thing that I just, every time I get an opportunity to speak is just to emphasize the need for all of us to have a little bit more empathy for each other. And I think we can, when we're behind a keyboard and behind a screen, we can sometimes forget that the person that we're usually talking to or connecting with on the other side is a human, and they've got their own struggles, and they've got things that they're going with in their lives. And at the end of the day, we're all human. And so I think just having a little bit more empathy for each other and what people are going through. I feel like so many people just like let it out these days on Twitter or other, medium forms in which they can, express anger. And I think just having a little bit more empathy for each other and the world and what everyone's going through would make for a much happier and healthier place for all of us.
I agree with you. And thank you for sharing that. And thank you for reminding us all of that. And thank you for your time. Thank you for coming on to our show and talking about what you've built and inspiring other founders and just sharing with the world what's possible in the mental health space. I'm really grateful for your friendship. I'm grateful for the advice you've given me in our business, and just couldn't say enough about how thankful I am for what you're doing in our space.
Thank you so much for having me. This has been awesome. And appreciate you helping to destigmatize mental health as well. So thank you.
Thank you again, Alyson, for being here today and sharing with us. You're truly a pioneer in this space, and I'm grateful for your support of what we're doing with the podcast and what we're doing at What If Ventures. There are a number of ways that people listening can connect with Alyson. We will link to her LinkedIn and the Modern Health website and some others in the show notes. To our listeners, thank you for being here. And please, if you like the content, give us a subscribe or a like or a review on your podcast platform of choice. And more importantly, we'd really love to have you share this episode with a friend and reach out to us, connect with us. To the founders out there, don't forget to join the Mental Health Startup Slack community. You can find a link to that in the show notes. Also, check out the What If Fellowship program, which is an 8-week accelerator designed to help mental health and digital health startups broadly validate their ideas, perfect their business plan, and prepare to pitch investors. You can learn about that on the Fellowship tab of the What If Ventures website or in a link in the show notes. Like I said before, we really want to hear from our listeners, so please do comment on social media. Let us know what you liked, what you want to hear more of, what you disagreed with. You can reach out to us on Twitter at StigmaCast. You can find us on Instagram at Stigma Podcast. You can email us at info@stigmapodcast.com. And you can obviously find us on the internet at our website, stigmapodcast.com. Thank you again for being here. And until next time, stay safe, be well, and thank you so much for your support.